Hello and welcome to NUS 768 Statistics 2. The purpose of this brief presentation is to provide you with an orientation to the course, which will be delivered online. Let's first start with a look at our course description. The purpose of this course is to provide advanced coursework in applied statistical approaches to data management and analysis with an emphasis on multivariate statistical approaches. Students will develop improved skills in conceptualizing, executing, analyzing, and interpreting advanced analytic strategies, and to enhance their ability to propose strong, tailored analytic approaches for specific study designs and research aims. Students will gain proficiency in using statistical software to enhance their knowledge of regression, ANCOVA, MANOVA, MANCOVA, discriminant analysis, exploratory and confirmatory factor analysis, structural equation modeling, multi-level modeling, and advanced categorical approaches. Emphasis will be placed on the understanding of the mathematics, logic, and application of these techniques. So we have a lot to cover this semester. So let's take a look at the modules that we'll be working through. First, Module 1. In this module, you'll be looking at parametric versus non-parametric statistics, and please don't be surprised if some of this content is a review for you. We know that some time has passed since you had your quantitative design course as well as your first statistics course in the program, and so we just wanted to provide a review and perhaps reiteration of some of the concepts. In Module 2, we'll be looking at multivariate techniques. In Module 3, we'll be comparing groups. Module 4, we'll be discussing measurement validity, and in Module 5, we'll be discussing path analysis and structural equation modeling. So let's take a brief look at the course. When you are on the home page, you should see the course description as well as the learning outcomes. Your syllabus is posted here. You will have your modules. You can access those underneath the modules tab on the left. And your assignments, a list of those should be complete here as well. Your assignments for each module should also be linked under the module on the modules page. So let's take a look at your instructors. So first, I am Dr. Heather Carter Templeton, and I believe that we have worked together before in this program as I taught your first informatics course during your first semester. So it's great to see you all in this course again, and you all may remember my area of expertise is in informatics, and I spend a good deal of my time doing research related to information literacy and nurses' use of evidence-based practice. But we also have this semester Dr. Gary Templeton, and I'm going to let him share a little bit about himself. He'll be serving as our guest lecturer and our statistical consultant.
Hello everyone, my name is Gary Templeton. I'm a professor of business information systems at Mississippi State University. I'm here because I've published in business in the area of statistics, and I like data analytics. I'll be interacting with you later on in the semester during an optional statistical consultation if you want to utilize that. I hope that you can remain productive during these unprecedented times.
And we are happy to have Dr. Gary Templeton with us during this course. He brings a lot of expertise and experience related to statistics. Great. Let's go ahead and just review a couple of things related to statistics. So difficulty in understanding statistics is one of the most frequently reported barriers to nurses applying research and practice. And I don't know if you all recall this, but when we first met in informatics, I think I may have shared with you a statistic that I still find alarming, in that it takes about 17 years to get research into practice. And so there are a lot of barriers to nurses' use of research, evidence, and practice, and just difficulty understanding statistics is certainly one of those barriers. So why statistics? Well, statistics helps us understand our population of interest, right? One of the most powerful statistics for affecting change in nursing show that each additional patient added to the United States nurses' patient load had an associated increased patient mortality of 7%. Now, you may recall that study, but basically they found that more nurses equals less deaths. So in using statistics to communicate that message, it's really hard to argue. It's hard to argue that instead of general complaints about overworking and understaffing. So statistics can certainly help us make our point. Also, it helps us to understand ourselves. Using statistics, we can often describe or measure our own performance, explain what we do understand and what makes us different. And so this helps us as well. We can also use statistics to help us compare options for practice. And this, we've seen plenty of evidence in the research literature. How do we really know our nursing interventions are effective? What dressing should we use for this type of incision or this type of wound? How often should we change it? Should we use sterile gloves, clean gloves, etc.? Statistics tells us that neither replacing intravenous administration sets or fluids prior to a week is likely to reduce infections. We have a number of research studies with important vital statistics that we can share and that help us once again really declare what we do and why we do it in the clinical setting. Statistics also help us challenge and challenge us to rethink our assumptions. So statistics can help us to not to be confused or deceived. It can help us make good decisions, but it also can help us from making bad ones, so we can avoid the what not to do's. Statistics can help us develop our profession. Advancing nursing as a profession really requires statistics to develop and inform best practice. And again, we've seen that over the years in the growing body of literature. And I'm very interested this semester to find out how you all have grown in what you're thinking with regard to maybe statistics that you've read about your topics and how you're going to move forward with your research questions and the work that you're going to do. Florence Nightingale, we talk about her a lot, but the founder of professional nursing really, and I would say the first nursing informaticist, but she was committed to using statistics and used them effectively to improve practice. And she used them to lobby change and changes to government policy. So just a great example for how statistics can be used to help us improve the care we give. Stats can help you in your personal life as well. We know the general public has difficulty understanding statistics and interpreting what people are saying to us. We have seen a lot of this lately with COVID. All of the different forms of data that are available, all of the things that are shared through news media, through research literature we've seen even, but there's sensational claims. There's often poor reporting involved. Whatever side you stand on these things, you can usually see this. So understanding basic statistics is crucial to the things that we do in life to make decisions, to quantify our risk, or just to understand the news. They also teach us to be cautious. So statistics rarely prove anything and remind us that human life and experiences are complex. Finding out that A causes B can take multiple studies, often with conflicting results. And again, you don't have to look very far. we're seeing that now in the research related to COVID and what works and what doesn't, and what causes what, A causes B. So it's important to be able to look back and or stand back and see the bigger picture and the answer evolving rather than just hanging on to one finding. So so keep that in mind. Also, it's pretty fair to say that statistics are not going away. There's an expectation that nurses need to understand and use statistics. It's really growing, that notion. So people that have avoided it really can't afford to avoid it any longer. So it's hopefully this course will offer you more information and knowledge that you can apply, again, not only with your research, but the things that you're doing daily in the clinical setting and even in your personal life. So we would invite you to send any questions about the course at any time to me. And again, as Dr. Templeton said, he will be offering what we hope is a very beneficial optional consulting session so that you might be able to share what you're wanting to do with your work and maybe considering different statistical approaches that might help you. So as always, please contact me if you have any questions about the course or the content.